Thank you all for coming, and special thanks to my daughter, my teenage daughter, who got up at 4 o'clock in the morning to get on a plane and come down here to be with us here. My name's Ilan. I'm the founder and CEO of Precipio, and we started our company 8 years ago with the goal of battling the problem of misdiagnosis. So I want to share a few thoughts with you about what we found and what we think we can do to help. So let's start with a little bit of a few numbers. Unfortunately, this year, 17 million people will be diagnosed with cancer. And even worse than that, 10 million will lose the battle for cancer. What's even more scary is that 1 in 4 people are misdiagnosed. Think about that, 1 in 4 people. Look around you, think about the people that you work with, that you live with, that you interact with. Those are all people who are going to be misdiagnosed. And so this is a very scary problem, and you got to ask yourself, in an industry that spends $3.5 trillion in the US, almost $100 billion on cancer, how's that possible? How does that happen? So let's start by talking about what does it mean, how is cancer diagnosed? There's cancer patients here and cancer survivors. You've all worked with your oncologist, spent time with your oncologist, received the diagnosis from the oncologist. Most of you probably don't know that actually the diagnosis was rendered by a pathologist. And there's actually studies that show that more than 50% of patients aren't even aware of the existence of a pathologist. And that's a really important point. We'll come back to that a little bit later. And so the pathologist is actually the person who diagnoses the patient and diagnoses the biopsy and renders a result based on which the oncologist treats the patient. So oncology is actually unique as opposed to any other area in healthcare in that any other field, you come to the doctor, they check you out, they examine you, they say, okay, this is what you have, and this is how we're going to treat you. In oncology, those are 2 separate fields. The oncologist does not diagnose the patient, the pathologist does not treat the patient. Each of them has their own role. How does it work? Well, a patient gets biopsied when there's a suspicion of cancer. The biopsy is sent to a laboratory. The laboratory creates slides, which are essentially small slivers of the biopsy that go on a piece of glass, and the glass gets evaluated by the pathologist, gets reviewed so that they can arrive at a diagnosis. The diagnosis is put into a diagnostic report, which is issued back to the oncologist. That's the process. And that may sound simple, but let me give an example of how complicated it is. It would recognize the picture on the right? Thank you very much. That's right, Manhattan. Okay. How many people here like a good juicy burger? That's it? I don't believe it. Okay. Well, I'm going to let you on a little secret. How many people here have heard of the restaurant called Chumley's? 1. Really? You've been there?
I haven't been there, but I've heard of it.
Okay. Well, I'll let you on a little secret. Chumley's is the best burger in New York City, and it's actually the best kept secret as well. So this is Chumley's. And if you look at this building, this is one of the most saddest looking buildings in the West Village in New York City. It has a black door with 3 black windows around it. There are no signs for the name of Chumley. As a matter of fact, the only way you know that you're there is the door to the right of it has a small sign that says, not Chumley's. That's a clue. And every day on this busy street in the West Village, thousands of people walk by not knowing that behind the doors of this pretty simple-looking building are the best burgers served. Now, why am I telling you all this? Let's go back to New York City. As you can see, the picture has a lot of small dots, black dots, white dots. Those are buildings and blocks of Manhattan. Now, imagine that you have to look and pinpoint where Chumley's is and find that restaurant. That's a pretty tough job. Now, look at the picture on the left. That's a picture of a biopsy slide. And if you see the little small black dots, those are cells. And the pathologist's role is to look at those cells and identify an abnormality. Pretty tough, right? By the way, this is where Chumley's is. Oh, sorry, down there. So this is the role of the pathologist. Add to that the fact that the industry has driven pathology to be more of a generalist. Okay, so imagine 25 years ago, a hospital used to have maybe 5 or 6 pathologists, and one of the pathologists did breast cancer, and the other did lung cancer, the other did skin cancer. Well, nowadays, most pathology departments have shrunk to 1 or 2 pathologists, and they have to do everything. And the result of that is they develop no specialty, because they have to be generalists. Now, that's a problem in itself, but it's even a worse problem when you look at the complexity of cancer. So look at these 2 types of cancers, lymphoma and breast cancer. And we noted the subclassification. So 25, 30 years ago, there are about 25 subclassifications of lymphoma. That's quadrupled. And each of those is a different disease with a different treatment state. So it's really important to identify which is the right disease. Breast cancer, similar, has gone from about 5 to 35 types of cancer. How do you become an expert and figure out which one of the 135 types of lymphoma are when you're seeing 2 or 3 lymphomas a week or a month among the other kinds? That's really difficult. And so what we did was we figured out where that expertise exists, and that's within academic institutions. And so we built a platform with the top academic institutions in the country where each one of those have those subspecialists. Why do they have those subspecialists? Because in academia, the career path of a pathologist is geared towards specialization, right? These are folks who decide to remain within the university, and they pick a disease state or something they want to focus on, and they study it for the next 30 years. So if a patient has a T-cell lymphoma, which is a type of subset of lymphoma, there are within our network 3 or 4 pathologists that have spent 30 years studying T-cell lymphoma. That's all they've done. And that's the level of expertise. If it was my friend or relative, I want them to be diagnosed by that expert. In our platform, we have over 1,000 experts, each one of them covering all the different types of cancer there are. And each one is an expert. Our solution brings this capability to any patient in the country and any patient in the world. And so anyone can go online and arrange to have a second opinion, a second look, essentially, on their biopsy by an expert. This is covered by insurance, and the most important thing is the following. Less than 10% of patients use this tool called second opinion. Why? That's crazy, right? Everyone's sitting here thinking, why wouldn't you use that? Remember, we talked about the fact that there's an oncologist and pathologist, but most people don't know that it's the pathologist diagnosing the case. That's why patients don't ask for a second opinion, because they're afraid to offend their oncologist. This is the #1 reason, as crazy as it sounds, they don't want to offend them and challenge them. And so what I'd like everyone to do is at least leave with this important piece of information and tell your friends and tell your family and tell your relatives that this is a different person. And by the way, every pathologist I've ever met has never had a problem with someone saying, you know what, we're going to have a second look. Have someone else take a look at it. That's fine. We're the patients, right? This is our body, and we're in charge of our health care. In this last 8 minutes that I take the presentation, 35 patients have been misdiagnosed. 35 patients. So if you take anything away from this, please, anyone who's watching here today, let anyone around you know that this is a really critical tool that is available. Our vision is to make sure that no one ever has to say, geez, I wish someone in my family, they got it right the first time. Thank you very much.